Hello and welcome back to GP Video Podcast by Nadia. So I've also decided to start a series of small video podcasts where I would be doing explaining actually some diagnostic triads for you. What is a diagnostic triad? Triad, as you know, it means three. So diagnostic triad is a combination of three symptoms that you would have, and then we would be making our diagnosis on basis of that. So the diagnostic triad that I'm going to start with you today is, so I would also like to share our knowledge with you. So when, God forbid, you have these symptoms, then you know, okay, so this could be the possibility, this could be the possibility, and this could be the possibility. So the first diagnostic triad, which is very common, which anybody can get, and I'm sure all of us have had in our lives, is abdominal pain plus diarrhea plus fever. Abdominal pain plus diarrhea plus fever. Yes, it could be also accompanied with nausea, vomiting, and other symptoms, body aches, feet, and other stuff. But the most important three symptoms: abdominal pain, upper, lower, side abdo pain, any kind of fever, and diarrhea. So what are the possibility diagnoses? Number one is gastroenteritis. Number one, which could be viral, which is also known as the stomach flu, or which could be bacterial, which is also known as food poisoning. So that is our number one diagnosis that comes to our mind when you come with abdominal pain plus fever plus diarrhea. Number two is COVID-19. Yes, COVID-19 also comes to our mind when you come off to us with these symptoms. Also, it is very understandable that it could also be accompanied with respiratory symptoms, or it could just be this, because COVID-19 can only present with these gastrointestinal kind of symptoms. And number three is chronic conditions of gastrointestinal tract that could have had flare-up. So the number one diagnosis that comes to our mind is flare-up of Crohn's disease, which is one of the kind of inflammatory bowel disease. So Crohn's disease and diverticulitis are two that come to our mind the most. But I would also like to tell you that here another thing I would like to explain, which is called colitis. What is colitis? Infectious colitis is the same as bacterial gastroenteritis, because gastro means stomach and enteritis means intestine. So infectious colitis is the same as our inflammation of the colon. Colon, as you know, is the large intestine. Is same as bacterial gastroenteritis. Then we have pseudomembranous colitis. Pseudomembranous colitis is also a bacterial condition caused by Clostridium difficile, which usually causes the infection of the colon after long-term use of antibiotics. Then we have got allergic colitis, which is caused by food allergies like let's say lactose intolerance, let's say gluten intolerance. Then we have got ischemic colitis. Then we have got irritable bowel disease. Irritable bowel disease has got three types: ulcerative colitis, microscopic colitis, and number three is Crohn's disease. So with abdominal pain, fever, and diarrhea, the types of colitis that we can suspect is infectious colitis, which is again same as bacterial gastroenteritis. We can also suspect pseudomembranous colitis or Clostridium difficile colitis. We can have also think about the inflammation of irritable bowel disease, most probably Crohn's disease or ulcerative colitis or microscopic colitis. So these are the conditions. Again, abdominal pain, fever, and diarrhea. These three symptoms could be accompanied with nausea, vomiting, could be accompanied with body pains and aches, could be accompanied with respiratory symptoms. What are the three most important diagnoses that come to our mind? Number one is gastroenteritis, which could be viral, which is known as the stomach flu, or bacterial, which is also known as food poisoning, or which is also known as infectious colitis. Then number two is COVID-19, and number three is flare-up of chronic gastrointestinal conditions like Crohn's disease or diverticulitis, or in other parts of colitis could be like, so most probably ulcerative colitis, irritable bowel disease, which consists of ulcerative colitis, microscopic colitis, or Crohn's disease. So the inflammation of these. So gastroenteritis, which can have both viral gastroenteritis or bacterial gastroenteritis, which is also known as infectious colitis, and pseudomembranous colitis, Then number 2 is COVID-19. And number 3 is infectious or just the acute flare-up of infectious or non-infectious acute flare-up of chronic gastrointestinal conditions like diverticulitis or Crohn's disease. What is Crohn's disease? Crohn's disease is a form of colitis, which is a form of inflammatory bowel disease. So colitis, inflammatory bowel disease. Inflammatory bowel disease has got 3 parts: Crohn's disease, ulcerative colitis, and microscopic colitis. Usually people with chronic gastrointestinal conditions usually know that they have this condition, and whenever they have abdominal pain plus diarrhea plus fever, they come in for antibiotics, for steroids, for painkillers, because they know that they have got the flare-up of, let's say, diverticulitis, flare-up of Crohn's disease, flare-up of ulcerative colitis, flare-up of microscopic colitis. So they already know all about it. Alrighty, we'll talk about another diagnostic triad in another small or short video of GP Video Podcast by Nadia.